So what is compassion here? Compassion is constructive response to suffering. It enhances treatment outcomes, fosters the dignity of the recipient, and provides self-care for the giver. So compassionate care is associated with improved outcomes and greater patient adherence. Amongst providers, extending kindness is associated with reduced burnout and greater well-being. In palliative care, compassion is seen as a virtuous response that seeks to address the suffering and the needs of a person through rational understanding and action. It is a key aspect of high-quality palliative care. Now, some of the factors that actually block compassion in palliative care are, first one would be economical pressures. The second one is moral distress. The third one is rather obvious, yet very, very critical, that is work overload. The fourth one is a toxic organizational culture. The fifth one is lack of adequate communication and compassion training and lack of self-care. Now, during any session that I conduct, I often make it a point to talk about the importance of self-care. Why is self-care so very crucial? Self-care is crucial for the simple reason, the more we are conscious of taking care of ourselves, the more effectively will we be able to take care of other requirements in our life, whether it is personal or professional. So taking care of oneself is very, very critical, no matter whatever profession we may be or whatever position in life we may be. Self-care is always critical. And I think it's very important that its importance is taught to someone when they are a child, because it becomes easier then to follow a pattern and a structure of lifestyle where you are giving some amount of time and attention to self-care. And I can assure you, to all of you, that self-care need not be seen as something which is selfish, because that is also a question that has often been asked to me, whether if we are paying attention to self-care, are we not being a little selfish? So another thing I'd like to mention to you here is, how does uncompassionate care cause a challenge? It causes a challenge because it negatively affects not just the patients, but the family as well. Now, we also need to consider that when there is lack of compassion, when there's lack of compassion in palliative care, what happens is it also tends to determine the economic, the legal, and the public image affectations of the institution involved, in this case, the hospital involved. What are the consequences that would come through? So what do palliative care providers require? The first one would be regulatory and financing mechanisms. Now, definitely, they need to have such kind of mechanisms in place so that there is a lot of emphasis on the quality which is being provided to the patients, as much as the care and the support being given to the family members as well, who are being there for them. The second one is education. Now, under education, the training will come under. What kind of training is being provided for the staff and, of course, the support team in the palliative care unit? And I think when it comes to compassion, it can never be stressed enough, because compassion, as we all know, can not just help patients, but it also makes the family members feel very, very comfortable when it comes to knowing that their loved ones are being given the best possible treatment, not just medical assistance, but also in terms of the support and the basic care that they need to make sure that they are comfortable. The third step is also to create public awareness about the importance of compassion and palliative care. So the public are also very, very conscious when it comes to palliative care and how important they need to also be aware of, or then they are also possibly even visiting patients. How do you show compassion? The first one is practice good manners. I think that is important, whether you are in you're in any organization or whether you're part of any team, practicing good manners. The second one is show personal interest. The third one is to take time to think about what the patient as well as the family members may be going through. Now, I'm not sure how many of you have had the unfortunate experience of seeing your loved ones in a palliative care unit. If you haven't, I'm extremely happy and I'm grateful to God that you haven't had that experience. Fourth one is acknowledging the feelings. And number 5 is also, when it comes to caring, taking time to take care of your own needs. We need to take care, especially if we are working in a palliative care unit, to take care of your own requirements or our own requirements. This is where self-care comes in. So self-care can never be stressed enough, actually. So some of the areas, we have 6 key areas of care that is very, very crucial, whether it's in a palliative care unit or whether it is in any other self-care related or social welfare, related organizations that includes orphanages even, or residential institutions for the elderly, or for the I think people who require assistance, who probably have been abandoned by the family. So anywhere where this compassion is playing such a crucial role, there are 6 key areas. The first one is, of course, care. Care is the first one. The second one is compassion. So how do we show compassion is something that I have already discussed. The third one is courage. Absolutely. I think anyone who would have worked in a palliative care unit knows how important it is to be bold, it is to be courageous. And I think courage is something which not just the staff of a palliative care unit requires, but also the family who's supporting and who's there for the patient, who's in the palliative care unit as well. The fourth one is communication. So communication is very, very crucial. So I think when you have family members who want to just talk, it need not even be something relating to directly to the future treatment of the patient in the palliative care. It could just be the present situation. Are they receiving the right care? Should we take the patient to another place? Now, these are all questions which family members often are thinking about. And these are questions which keep coming up in the family member's mind as well. I remember speaking to Dr. Ranjana when I was actually asked by my father, who was a patient there, that why don't we go to another hospital? And we might be able to get better care there. Of course, we naturally never informed him that his condition was very critical. Naturally, I don't think anyone would actually mention to a patient. However, when he was talking about it with such hope, it really pained me because I knew that was not possible. He was in no condition to be shifted, and he was in no condition to even receive further care. Because apart from the hospital, I had taken his medical file, and shown it to other doctors as well. And all of them had the same thing to say. So I wanted to speak about this with Dr. Ranjana, and she was extremely sympathetic. she showed a lot of compassion as well regarding my concern. Because on one side, I wanted to make sure if he could be taken to another hospital. But on the other side, I knew that I would only be putting him under greater pain and distress. So speaking to her helped. And how was I able to speak to her? Because she was so very supportive and understanding and patient regarding my concern. So she clearly had the strength regarding communication when it came to being a doctor in the palliative care unit. And of course, the sixth one is competence. And competence just is not just very, very crucial. I have mentioned it at the end because even though competence is very, very important and critical here, it is almost something which is obvious. So we have care, we have compassion, we have courage, communication, commitment, and competence. Sorry, I didn't mention commitment. Commitment also is critical here because no matter what it is, they need to be there. It is part of showing the compassion. You need to show to a patient and a family member of a patient who is in the palliative care, helping support the patient to be more comfortable. So all in all, I think no matter whether it is in a palliative care unit or anywhere else, and no matter what profession we may be in, whether in our personal or professional life, the role of compassion, kindness, plays a very, very critical role. For the simple reason, because it makes us more conscious about our purpose and about our responsibility that we have as a member of society.